Super glad to have Giselle Carino here with us today. Giselle is the CEO of the International Planned Parenthood Federation in the Western Hemisphere region. And today we really are going to have a conversation about the state of women's health and the state of women's rights in the region, and how the International Planned Parenthood Federation is navigating the region's rapidly changing political, economic, and environmental landscape. I am delighted to have a woman leader here today to talk about this important issue. So welcome, Giselle.
Thank you so much. Thank you for such a kind introduction. Thank you all for joining this conversation. Thank you both John and Luis for making this happen. It's a great opportunity to be here. Coffee is great in Mountain View. I look forward to the next opportunity. Thank you very much.
Good. Well, Giselle, I always like to start these conversations with a personal story. So can you tell us a little bit about how you got interested in this work and sort of how you got to where you are today?
Well, I grew up in Argentina, in rural Argentina, and when I say rural, I mean rural. I remember receiving the Sunday paper at 4 p.m. That's rural. And, I went to an all-girls Catholic school. And this is not at all a comment on faith, as you just mentioned, we work with progressive religious leaders, and I'm part of the board of Catholics for the Right to Decide. But, I remember we used to be, girls playing on one side and boys playing on the other side. And I remember always asking the question, like, why is this? I have brothers and cousins, and we used to play together, and things were different there. And I remember the answers were not quite satisfying. And then as I grew up, my parents would say, like, what do you want to be when you grow up? And across the street, there was a farming school full of boys. And I thought that was really cool, like they used to be outdoors all the time. And I said, I want to be a farmer. I want to go to that school. And they would be like, not really, that's for boys. And I was like, why is that? And again, not a very satisfying answer to that. And then I think all of it came together when I was in secondary school, and one of my best friends got pregnant. And she wasn't rejected from school, but she couldn't be part of us anymore. The social stigma associated with teen pregnancy is huge, continues to be huge. And so I think all of it came together, and it was clear that it could have been any of us, that we needed the information to be able to protect ourselves, to lead healthy lives, and that wasn't there, that wasn't available to us, right? I also grew up, during the dictatorship in Argentina. I was born in 1976 in June, and now my age. And the dictatorship began in March of that year. So I remember that crushing sense of that things would never change, and then when democracy came, that feeling of it was in our hands to make that happen and to protect it. So I think all of it had to do with ended up where I ended up in Planned Parenthood, doing work for women's rights. I truly believe that there isn't the possibility of development without half of the population being included. And sexual and reproductive health and rights are key, right? Deciding if we want to have children, when we want to have children, with whom, is critical to us being full participants in society. So all came together there.
I love that. Well, thank you for sharing your personal story with us. And I always appreciate that, because it sort of gives a sense for, how you got to where you are today, which I think a lot of people always want to know about. Tell us a little bit about sort of the wide range of services that Planned Parenthood does provide, and sort of what the population you serve looks like.
Yes, well, we last year alone served about 6 million women in Latin America and the Caribbean, and provided roughly 30 million services, from really PAP screening, cervical cancer screening, sex education, gender-based violence services, access to contraception, and safe and legal abortion when that is allowed by the local laws. One thing that I should mention is that, we are a global federation, so we have a presence in about 150 countries around the world. We represent Latin America and the Caribbean. We work with 40 independent organizations, non-for-profit organizations that are affiliated to us. I don't know, how many of you do know of Planned Parenthood Federation of America? Many of you know, right? Yes, they're great. They're our great partner in the US. How many of you do know of IPPF or International Planned Parenthood Federation? Probably not too many, right? It's okay. Planned Parenthood Federation of America is our partner in the US, and like that, we have partners in 150 countries globally or so. Many of them providing full care, comprehensive sexual and reproductive health services for women and men. About 10% of our services are to men. And we have a big focus on youth across the world, and in particular in Latin America and the Caribbean. About 40% of our services go to young people. Yeah.
And in a lot of those cases, are you providing free or low-cost healthcare to the patients that come in your door?
Yes, we do. And we not only have clinics, in many of the countries, there is a game I like to play when I go. I spend much of my time visiting clinics and programs in Latin America and the Caribbean. And when the taxi driver picks me up from the airport, I always ask, so do you know our local clinics? Have you been there? Are your friends went there? And the answer to those questions normally is yes. They know our clinics because we've been providing services now for 50 years in the region. But we not only provide services in the clinics, we also run community-based programs down in communities where other people wouldn't go, right? And all of those services are subsidized, and many of them are free of cost, indeed.
So probably for a lot of these women, especially in rural communities, the Planned Parenthood clinic might be the only clinic that is affordable and accessible for them. Is that right?
Indeed, yes.
So you've been with the organization for over a decade, which is quite impressive. Can you share what's changed in that time over your service with the International Planned Parenthood Federation?
Well, it's interesting because I transitioned. I am a first-time CEO and transitioned to become the CEO last year. Arguably not the best year to transition to anything called Planned Parenthood. It's a year, full of challenges. And I think my work before was programmatic work. I spent time with women and the communities. And I think I saw a great change in terms of, we have been able to lift many people out of poverty in Latin America and the Caribbean. We still remain as one of the most unequal regions in the world. That means that if you are young, if you're poor, if you're from an indigenous community, if you're Afro-descendant, the way you experience life, health services, your needs are different, right? Most of our countries are considered now middle-income countries. And this means that donors have pulled out from the region, but huge pockets of poverty and inequality remain. And the people we serve are these people, right? So we need to continue investing in this program and in these services. I think we know that we have done great advances. We have been there for 60 years. We have brought contraception to many of these countries. Emergency contraception, what is called the morning after pill, should be called the as soon as possible pill, because actually you can use it up to 5 days after having unprotected sex, but the sooner you use it, the better. We brought that to many of the countries in which we are working. So we have made great strides in bringing contraception to women, but we know that we have 23 million women who want access to modern contraception and don't have it, right? So I think there have been great advances in general, but there are huge challenges that remain, and we have to continue working to close that gap.
For sure. In Silicon Valley here, we're technologists by and large, and so we always think about the role of technology in our work. So has technology played a role in the work of International Planned Parenthood Federation?
Yes, I think we have made important investments in technology. It might seem small to you, but we invested in making sure that we have electronic health records across the board, so that we can not only serve women better, but also assess the health outcomes over time. And that's an investment we have done over a number of years now. We think there are great opportunities for technological innovations. We are a region with high connectivity, and we have in front of us the largest generation of young people ever.
Wow.
Reaching them is a huge opportunity, right? It's a huge challenge as well. And I suspect that Googlers know how to help us close that gap, because I think probably technology has a key role to play in reaching these people with both information, education, and actual services. Unfortunately, telemedicine, all of that is not as developed as it is here, but we do follow very closely and love to try a few innovations that we know are happening in the United States right now, and that hold great potential to bring services to women in a much more cost-effective way.
Yeah, that's a fantastic opportunity for all of us here to think about and be involved with, for sure. So we do have a powerful female CEO here in our midst, and I always like to ask you a little bit about what that year has been like, and what are some of the key leadership challenges you've faced and the lessons you've learned in that year.
Well, it was clearly a tough year. Not only, we had a new U.S. administration, not quite favorable to our issues. Mm-hmm. And, everything that happens in the U.S. has an impact overseas. The U.S. used to have a leadership role on these issues. That's no longer the case. And President Trump imposed, as soon as he took office, the global gag rule.
Yeah, talk a little bit about that, because I'm not sure everybody's familiar.
Yeah, every Republican president since Reagan put in place something called the global gag rule, which limits the ability of organizations overseas that receive U.S. funding to either advocate for change in the laws and policies in relationship to abortion, to provide abortion services with their own resources, even if abortion is legal in that country. And the money normally from the U.S. government was for work like access to contraception, gender-based violence. What Trump did was impose a rule of really unprecedented proportions, touching every source of funding from the US government, including tuberculosis, malaria, HIV/AIDS. So normally about 600 million of US foreign assistance money would be gag, as we call it. In this case, it's about $8.8 billion.
Oh, wow.
So this is a policy that has the potential to really do serious damage to women around the world. We, as an organization, decided not to be gagged by this policy. We, will give up about $100 million as a whole. Wow. And we think this rule is unfair and unjust and harms women, and really has the potential of harming women across the globe. So that was a big challenge we faced as soon as I took office in, I think in April last year. We had Brexit in July, and mm-hmm. we had the elections in November, and this happened right after in January. So I think that was one of the biggest challenges. The second one, you might have heard, we had a string of natural disasters yes. affecting the region over the past few months. Again, disasters of unprecedented proportions. Our clinics have been badly affected, our teams. What is really amazing to see is, we had the earthquakes in Mexico. The day after, our teams, people in our office lost their homes. They show up to work to provide care for women, not in the clinics because the clinics were damaged, on the streets. Wow. Wherever that was possible, they were there to help women, because we know that one of the things that happen when natural disasters affect is that the needs of women and girls are normally not the priority. But life goes on, right? Mm-hmm. People continue to need contraception. People continue to need prenatal care. And I think has been amazing to see the level of response in spite of such a difficult situation. And maybe, if I am allowed a second to talk about Puerto Rico, because
yes, please.
Puerto Rico, is a case that hurts me, because the situation of the island was dire before the hurricanes hit, and 50% of the population living below the poverty line, many of them women. And then we have the hurricanes. And as you know, the response from the federal government has been limited, unsatisfying. I don't know how to, what objective to use to define it. And I feel like we have 4 clinics in the island, none of which are up and running because
Wow.
because we don't have electricity. We, we raise funding to buy generators, which is the way, and it takes a while for generators to get there because obviously everyone is trying to buy generators, and you can't keep them running all the time, so that will have some limitations. Gas is a problem, accessing gas to run them. We know the need is there. We have the infrastructure to serve women. We need help to get those clinics back in order and to provide the services that are very much needed because no one else will be doing that, right? So it's, I guess, a plea of help for the case of Puerto Rico in which the response has been with contempt. And it's very much in need. Yeah.
No, I think that's a really good point. And, as you point out, it really has been such a challenging year, from policy and politics and natural disasters. And I can tell that this work is very personal and it's very emotional. And I really do applaud your bravery and your courage and your leadership. How do you sort of keep your staff and your caregivers and your providers sort of, motivated to do this work in the long run because it can be very challenging and emotional and taxing?
Yeah, we hold tight to the good things. These people are fighters. They've been fighting in the front lines. These challenges are not new to us. Are bigger.
That's right.
It's always difficult. But our teams are there serving the needs of women. There is nothing more satisfying to me and to many of them than when you sit with women in the waiting rooms, when I travel and get to talk to women, the number of barriers they had to overcome to be there, and you have the answer to what they need. There is nothing more satisfying than being able to provide that. And I think that's holding tight to that is what keeps us going. And the support of so many of you. We couldn't do this work without supporters like you who are there to hold the line and support us every step of the way. So thank you. Thank you very much.
And thank you for motivating, your team of caregivers and providers to do this work. It's really quite incredible. You talked a little bit about how oftentimes when a young woman gets to your clinic, they've overcome a lot of barriers just to get there and be present that day for their services. Can you talk a little bit about some of those barriers these women face?
Yes, and we work to help them overcome them. I'll talk a little bit about our cervical cancer work, which I think is a good indication of that. Cervical cancer is still a killer for women in Latin America and the Caribbean and across the globe. And it's caused by a virus called the HPV virus. There are many strains of the virus, but 2 that really cause cervical cancer. And there is a vaccine that is available in developed countries. So we partner with the Ministry of Health in Bolivia and our member association there to bring the vaccine to Latin America and the Caribbean. And it was quite pricey at the moment. And normally here, women would take girls. The vaccination range is between, I think, 9 and 12 years of age. And to the pediatrician would offer the vaccine. The vaccine has 3 doses, so you have to go 3 times a year with your girl for the vaccine. So when we began looking at this program and knowing, many of the women we serve, work in the fields, selling food in the market, they can't just take the day off to do this. They might not have enough money to feed their family that week if they do so, right? So we developed this initiative and apply the vaccines in a pilot program in schools, because we know a high proportion of the girls are in school. They don't need their mothers there, and we had very successful rates of vaccination, higher than any other vaccination program in this pilot initiative. So we try to bridge the gap, because when you work in low resource settings, we have to be creative and disruptive in the way we think through programming, right? So that has been, I think, a very good example of trying to find people where they are and help them overcome the challenges that they wouldn't have otherwise.
That's fantastic. I want to talk a little bit about a real issue and a real crisis in our society, which is the issue of sexual assault. We've seen movements like Me Too start spilling out to other countries, and we've definitely been hearing just more and more about the prevalence of sexual assault sort of to women around the world. How are you sort of thinking about that work and thinking about educating girls and women about sexual assault, sexual violence, sexual harassment, and the impact of those things to them?
I come from a region in which 1 in 3 women has suffered violence. I think of the 25 countries with highest homicide rates, feminicide we call them, against women, 14 are in Latin America and the Caribbean. I think, I follow very closely Me Too. I think it's great. There is a lot in women's storytelling, women coming forward and telling their stories. I think it was very interesting to see how that had a trickle effect, and about 12 countries, you have to love the French. They call it out the pig or something like that. I mean, it's just fabulous. And I think to see very quickly, even in Argentina, a few days after the Weinstein case in the US, we had a case for a journalist as well. I think there is a lot of power in people telling their story and coming forward. This is not just about solidarity, it's about self-exposure, right? And we know, those of us who have worked in violence, we know that for every woman that comes forward, there are at least 10 that haven't.
Wow.
And that is a pervasive element in our society. Also in Argentina, we are home of a movement called Ni Una Menos, not one less. This movement kind of happened organically as a result of a number of super high-profile cases of homicides against women, mostly by their partners. And we are 40 million, and they mobilize about 1 million people in the first time that they got together. Last year, they mobilized 3 million people. And you could argue, Argentinians like to march, but I think it was incredible, the mobilization, the digital mobilization. Many people show up at work dressed in black to mourn, to show their solidarity. And I think that's amazing. I think as a movement, or I like to think, we are reaching a tipping point. We no longer have to accept this as part of our life. And I think there is a lot of transformation going on. And if there is something to have faith, confidence on, is in the ability of civil society, of all of us, keeping this conversation going, because laws and policies will follow, but we first need to understand that this is simply not acceptable. We don't have to put up with this anymore. And that's right. That's the conversation that I saw going on that gets me very excited, because I think it's the beginning of the end.
Yeah. Which is a terrific sort of optimistic view, and I really thank you for that. You said something that really struck me. You said for every one woman that comes forward and reports a sexual assault or sexual violence, there's probably 10 more that haven't reported. How can technology, or how can our work help more women sort of be able to come forward and get the help they need and the support they need?
Yeah, I think it's what we are seeing. We have been one of the first institutions that created a health response to violence, no? And I think with technology, so much more can be done. I think, as I said, there is a lot of, it's very powerful for women to come forward, and they have done so, and appear, this is the conversation happening, the regular conversation. Everybody's talking about this. And I think technology is obviously a big part of that. It couldn't have happened before, this is not, I support X, this is Me Too.
Yes.
I am very much part of this, and I think it was possible because of the connectivity and the platforms we have to be able to express ourselves, and I think that's a great thing. That's a great thing.
Yeah, for sure. Tell us a little bit about how International Planned Parenthood Federation is approaching HIV and AIDS, the treatment, the care, the awareness in the region as well.
Yeah, we have, sexual rights and the work around HIV/AIDS have been central to our work. We integrated HIV detection services across our region in Latin America and the Caribbean. I have gone to the communities, work with the specific populations where the virus tends to be concentrated in the region has been a critical piece of our work. Luckily, there has been a lot of progress in the region on that issue, and some of our member associations even provide treatment. One of them, Dominican Republic, for instance. So we have been fully involved over the past 10 years in integrated service delivery on HIV, and feel very proud of the accomplishments in that area.
That's wonderful. I want to turn a little bit to some of the laws and policy in the region. So certainly, even in the States, we're seeing laws and restrictions being passed that make it harder to have access to safe and legal abortion. Are you seeing that as well in Latin America and the Caribbean?
Thank you for that question, because when I talked earlier about service delivery and education, and I forgot to mention that we really work around laws and policies that inhibit access for women's exercise of their rights, right? We work at the local, at the regional, and we also head the work at the UN on behalf of IPPF as a whole globally. What we are seeing in Latin America, we have a lot of laws and policies. The issue, the hardest nut to crack, is in the implementation aspects of things and making sure that the money exists to support service delivery. We are still home to 4 countries who have a total ban on abortion. And for those of you who might not know what that is that you can't access abortion services in any circumstances, not even to preserve your own life. And so it's a big challenge we have. I remember the case of Esperanza. She was a 16-year-old from the Dominican Republic who was pregnant and had cancer. And her treatment for cancer was denied because of her pregnancy. It would put a risk to her pregnancy. And in the Dominican Republic, along with El Salvador, Nicaragua, and Honduras, there are no exceptions. So she died. So she paid with her life. The Congress is still debating a bill to open some legal exceptions, but there is much work to be done in that regard. We have a number of countries that have legal exceptions on the books, but those have not materialized, in the life of women. They might exist on paper, but the implementation of those is oftentimes limited. And oftentimes we are one of the providers in those places in which legal exception exists for abortion care, for legal abortion care for women. We just had a big window. There was a total ban on abortion in Chile, and we just maybe I want to say 2 months ago were able to pass a legislation that allows for 3 legal exceptions to preserve the life of the woman for cases of rape and incest and cases of fetal malformations incompatible with life. And the law is limited in scope. It's only 3 circumstances. It was a legacy from the Pinochet dictatorship. But it's a big step forward for Chilean women to be able to access in these circumstances. And we still have 4 more countries to be able to overturn the total bans. We have the case, I don't know if you have heard or followed the news, we have the case of El Salvador. Women in El Salvador go to jail if they are suspected of having had a miscarriage for 30 years. So these are really draconian laws that need to change, and they need to be changed, definitely.
And so I imagine a lot of your work as the CEO of the International Planned Parenthood Federation in the Western Hemisphere is working with policymakers, influencing, lobbying for change. How are you finding the receptivity to these issues and their willingness to understand the issues, learn and adapt and change?
You know, we have, I think, great partnerships with the governments. We have, local organizations that are leading the work on the ground, just like PPFA is leading the work here in the US. That helps because the organizations have been there for 60 years. They have a reputation. They know what we do. Having said that, these issues are hard. And as I said, it's not only just changing the laws. Once the law changes, the real fight begins. And the fight is making sure that those services are available to women. So we are also act as watchdogs for the government to make sure that the laws are implemented, and quite importantly, that there is funding to support the provision of those services in the national budgets, because at the end we are there to support as much as we can. But this needs to be part of the country program, and that's easier said than done, right? When it comes to the reality, we have laws that have been on the books for 100 years now, and many of them, implementation is slow. It's a hard fight, but I think one worth fighting.
Very much so. I think you said something that it's definitely surprised me and maybe some of our audience too, is that there's a big difference between getting a law passed and the practical implementation of it. And I think sometimes as activists, we think our work is done when the law is passed, right? So the law is passed and change magically happens. And I think you're saying, hey, there's actually a long road between a law on the books and practical implementation on the ground. Are there steps that can be taken to sort of shorten that gap between passing a law and practically implementing it for the folks you serve?
Yes, we think in our experience, working with healthcare teams as the law, in building the support for the new law, it's critical because you got to have providers who are ready to provide services, not only ready ideologically, ready technically, right? So I think we have learned that if you engage healthcare providers from the get-go, not only they work with women every day, they know their stories, they can bring their stories to the public conversation, right? But also they are the ones who will have to provide services, and that has proved to be, I think, an important element that we have learned through the work we have done in the region.
Yeah, that's very insightful. Thank you. John, I just wanted to take a look or check with you. Are there questions from the dory? I certainly have a lot more for Giselle, but I want to make sure the audience gets their questions.
We do indeed have a couple.
Great.
Let's start with one of them. Molly asks, I used to work in public health in sub-Saharan Africa. One of the challenges I encountered was combating dangerous myths about reproductive and sexual health. How do you correct these misconceptions in the field, and is there anything that we at Google can do to combat this type of misinformation?
Of course, I think we heard it all, right? In terms of myths and misconceptions about contraception, about everything else. I think I could not stress enough the need to have comprehensive sexuality education for young people, and as early as that is possible. And not any type of comprehensive sexuality education, but one that it's evidence-based, that talks about power and relationships, that helps kids, young people maneuver their life and their relationships, and helps them challenge, the social norms around masculinity that are oftentimes the basis for machismo and for violence. I think that's critical. I think you at Google can help. As I said, we have the biggest opportunity ever. We have the largest generation of young people in front of us. Reaching them with the right information, it's critical, and I suspect you will have ideas on how you can help us do that, but it's definitely something that will be an investment that will pay off in the next 40 years. We know education pays off. Comprehensive sexuality education is not the exception to that. We have plenty of evidence of the type of sexuality education that works. And I think we just need to be able to reach kids in a school, out of school, with good information so they can actually lead the lives they want to lead. And I think it's critical that we do that.
Yeah, that's a great question. Thank you, Molly. Another one, John?
One more, actually, following along that one. Can you talk a bit about how you evaluate your programs for effectiveness?
Yes, we, for every program we run, we do an evaluation of the programs. Also, each member association runs evaluation of their own programs as well. Evaluation is critical for learning for us, and I think the program I was talking about in Bolivia on cervical cancer is again a good example, because we not only look about effectiveness, is the vaccine effective, is effective in this setting, we also look at, are there better ways? Are there most cost-effective ways of doing that? One thing that we are very happy to know now is that the vaccine that I was talking about to prevent cervical cancer, instead of having 3 doses, has 2 doses. Mm-hmm. Being able to deliver a program with 2 doses as opposed to 3 might seem a small thing. It's actually a huge thing, because in low-resource settings, if you can eliminate one step, keep the same results, you can use that money for other health pressing needs in the country, right? So we'd love to do much more, but we have a commitment to evaluate everything we do.
That's fantastic. One issue we haven't touched too much on yet is maternal mortality. And I'd love to understand sort of the prevalence or the demographics in your region around maternal mortality, and sort of a little bit about the harm reduction model that sort of really helps address the issue. Can you talk to us about that?
Yes, thank you for that question. The harm reduction model was developed in Uruguay about 10 years ago, and by a group of midwives and doctors who worked in a public hospital. And maternal mortality was always relatively low in Uruguay, with one exception, which was maternal mortality due to unsafe abortion. What happens in the region is that if you are a woman of means, even though the law might not allow for legal abortion, you can get an abortion from your doctor. The problem is that those who are not women of means simply die, right, from unsafe abortion. So this is what they face in Uruguay. They thought at the moment that abortion was restricted. There were a few exceptions, not really known by women and not really used by providers either. And abortion had a moment, but it also had a before and an after, where women had contacts with their providers, and doing nothing wasn't what they wanted to do, right? So they developed a model that allows them to educate women about what they shouldn't do if they decide to pursue an abortion, what not to insert, the warning signs, and also to come back for care afterwards. They couldn't probably help them in the moment, only if they were eligible for the legal exceptions. Otherwise, they didn't have the ability to help them, but help them with education, and they could come back for care when they need care. Post-abortion care is legal in all of the countries. And they thought this was very important. At the same time, there was a new drug called misoprostol that became available in the region, and it's a drug that saves life. Women can induce abortions. It's much more safer, and so providers would educate women on how to use misoprostol. They couldn't tell them where to get misoprostol, or they couldn't prescribe the drug. But based on the right to access information, they thought women should have access to the best information to preserve their lives, and this is how they built the model. And quite interesting, the model was expanded to several countries in Latin America and in Africa, and they dropped maternal mortality to 0. Wow. And in a matter of 10 years. They also paved the way, I think, for abortion law reform. Uruguay in 2012, passed a law that decriminalized abortion up to 12 weeks in the country. And I'm absolutely convinced that talking to women, educating providers was key to build support around the need of a law that would allow women to manage this part of their lives with safety and with good health outcomes. So I think it's a model was portrayed in the New York Times, and very much we are proud of that they were able to create and have a role to play in such a moment in women's lives.
Sure, certainly getting maternal mortality down to 0% is an amazing feat, so thank you for that. You know, we talked a little bit about the laws and the restrictions that you're seeing sort of come up in Latin America and the Caribbean, but talk a little bit about, you know, certainly in the US over the past several years, there have been a lot of restrictive laws passed, making it harder to access contraception, access safe and legal abortion. How does sort of the policy in the United States and the arguments and politics sort of around women's health impact the work you do in the region?
Yes, the U.S. used to be a place where we looked up for leadership on these issues, and as I said, that's no longer the case. But in addition to that, and in addition to the global gag rule that I talked before, that really curtails the possibility of organization to serve women, I say that what we are beginning to see is a much stronger, violent and aggressive opposition in the region, which is quite new. We had not seen that before. In a matter of a few months, we had, our offices vandalized in one of the countries, our executive director in another country with death threats, and things that we clearly had not seen before. We also have something that came up in Colombia that is called the gender ideology, a whole reframing conversation around, and it came right at the moment of the peace process, and against all of our issues, really, very strongly. And I think we have to think about, as a clear influence, there has been some reports recently, I think in The Guardian, about the role of the opposition in the US funding the opposition in many of the Latin American and Caribbean countries. And I think we are going to see more of that in the years to come.
Mm-hmm. So really the work we all do in our individual regions and countries really is interconnected. And so playing a role to actively advocate for policies that advance women's health are important for all of us.
Yes, absolutely. Very much.
John, any last questions from the Dory as I asked Giselle just a few last important questions?
There was one last one, which was a lot of the conversation around Planned Parenthood is on the topic of abortion, but I understand you put an awful lot of effort into other kinds of services as well. Could you perhaps touch on a couple of those?
Mm-hmm. Yes, abortion, if you look at our annual report, abortion services are about 5% of the services we provide. About 30% are services on contraception, cancer screening, gender-based violence, both detection, screening, and support. So when you look at the number of services we provide and the division, you'll see that it's a very small proportion. We feel very proud of the work we do on abortion, but we do much more indeed. And as I said, we have been leaders in bringing contraception to Latin America and the Caribbean, and have done so for about 60 years now. So yes, we provide comprehensive care to women. We feel we need to serve the needs of women, all of them, with no exceptions, when it comes to reproductive and sexual care. And that's how we stand as an organization. And that can be easily verified by our by our annual report. It hasn't changed much over the years, really.
Yeah, I think that's a great reminder of the resources available to us to learn about Planned Parenthood and the wide range of work you all do. So at Google here, we're coming up on our annual Giving Week. Googlers are very involved in giving back to the communities we serve and communities around the world through our time, through our money. What is the best way for a Googler who is interested in women's health and reproductive freedom what is the best way for Googlers to get involved?
Well, first, thank you, Googlers. We fill your lab. We are really very happy to count with you as one of our supporters. I think the first thing I would say, become a supporter. Donate to us. You can do so through our website, IPPFWHR.org. This is the moment. If none of the arguments before convince you, this is the moment to double down on women's rights, to reach deeper, to support all of the progressive causes. There is no best time to do that now, because so much is under threat, right? we just learned that you also have a program that you can spend your time with us. We would love, I think you have a lot of ideas and thoughts that could be very useful to us. And I think finally, again, you can help us bridge the gap in the most difficult issues we are facing, and will make a difference in the next 50 years in the region. So I love to engage in a conversation on how that could happen, accessing young people, working together to be able to enable that. So I think there are many ways in which, and of course, collaborating and supporting your local Planned Parenthood as well. We are a global movement, and the support is needed everywhere.
Yeah, that's fantastic. So I want to end on a positive note. You did talk about it is a challenging time for women's reproductive rights, for issues of healthcare, for sexual violence and assault. But in talking to you, I can tell that you have a lot of hope and a lot of optimism for a better future. And can you tell us sort of maybe a story or share a few thoughts about sort of how you keep that hope and optimism alive in this work, which is so important?
It's difficult, Danielle, let me tell you. There are days in which I don't feel necessarily this way. I think we have to keep an eye on the long fight, right? We've been here for 60 years, we'll be here for 60 more. We are not going to give up on women. And we have seen the change that happened, right? And if one keeps the eye on that long game, we know things are possible, and change will come. It will require a lot of effort. It's a back and forth. It's never a straight line to the finish. There is never a finish, right? But I have a lot of confidence in the role of civil society organizations, organizations like ours who will not give up. And I think it's very clear to us that this is a fight worth fighting, if anything. So, yeah, that keeps me going.
Well, Giselle, I've got to tell you, I think you instilled a great deal of hope and optimism for me today, certainly, and I know for our audience members. And I just want to thank you for that. I think, we touched on a lot of issues today, and I think really gave Googlers listening and the world listening a sense of sort of some of the issues that we're facing and the importance of getting involved. So I just want to thank you. We're very grateful for you and your knowledge, and most importantly, your hope and your optimism. So thank you so much.
Thank you so much. Yeah.